The drug makers who have dominated the weight loss market with injectables are now in a race to deliver the same result in a daily pill. Pharmaceutical giants Eli Lilly and Novo Nordisk both say they are in late-stage trials for a GLP-1 oral medication. Experts say this could be the first daily pill on the market. These could be. Joining me with more on where these trials currently stand is Jennifer Lake, pharmacist and assistant professor at the Leslie Dan Faculty of Pharmacy, University of Toronto. Thanks for joining us this morning.
Good morning.
I have so many questions. Let's start with what oral medications are being rolled out. What's the plan?
So there's 2 oral medications really that are coming out, and they just announced their phase 3 trials, which are really the last trials before they apply for approval in countries. And so it's orforglipron from Eli Lilly.
Catchy.
I know, no brand name for that yet. So right now that's how we say it. And then there's an oral tablet Wegovy, which is the semaglutide. So it's an oral of the exact same as the injectable we have now.
So we know that Novo Nordisk currently has a diabetes pill on the market, Rybelsus, right?
Yes.
You may have seen those commercials. They pop up all the time. How does that compare to what we're seeing in the trials?
So very similar to how we have Ozempic and Wegovy in injections. Rybelsus is like the Ozempic oral tablet, and then we're going to have a higher dose semaglutide, which will be called the oral Wegovy.
Okay, and what is the difference between injectables and pills?
So really they're the same drug. One of the things that's been with the GLP-1 agonists is because they are built like a hormone, when you take them by mouth, they hit the stomach acid and not as much gets absorbed in your body. When you inject it, it goes right into your blood, so the patient gets 100% of the dose. What we're seeing now is using higher doses to get the same effects as an injectable. And with the new one from Eli Lilly, the orforglipron, it's actually a bit of a different types of medication, and so it is absorbed better.
Okay, when you say better, so is it as effective as the injectable?
Yeah, so the 2 trials that have come out just in a European conference this month have showed that it's similar to the injectable Wegovy at lower doses or the oral Wegovy at lower doses. So that's really the question we have now is, if we do the oral Wegovy at higher doses, will it be a little bit better than the new Eli Lilly drug? And we don't know yet.
We don't know yet because the trial's not done.
Well, the trial is done at lower doses.
I see.
So we're seeing that the companies are coming out sort of saying, well, this wasn't the dose the 25 milligram dose of Wegovy, which is what we're expecting for the oral. It was done at the lower dose, a little bit between Rybelsus and Wegovy.
Side effects?
Side effects are going to be very similar. Because we're using these higher doses, we'll probably see very similar amounts of nausea and vomiting. And when we see the discontinuations, they are in about the 10 to 15% of people weren't able to tolerate these drugs. So that's very similar to the injectables.
Will they be cheaper?
So that's really what Eli Lilly is banking on. As we look around, they haven't applied in any country yet, so we don't know exactly the cost, but they're saying they're going to be lower cost than injectable Wegovy in the US. And we're expecting to see them apply to the US very soon. And that government has created a new program that can fast-track medications if they meet a public health need, if they will make the medication in the US. And so it'll be interesting to see if Eli Lilly goes that way. And they're saying it could be an 8-week turnaround. So it'll be very interesting.
So hitting the US first, when can we see this in Canada?
So usually we see the Canadian applications about 6 to 12 months afterwards. So we would expect that it'll be sometime at the end of 2025, early 2026, which makes—
In Canada?
Yeah.
Oh, that is soon.
Yeah, which makes 2026 really interesting because semaglutide is going generic, so we're going to see a lot of different products for semaglutide injectable.
When does that happen?
In January.
That happens in January.
So we'll see new injectable semaglutides and then these new oral medications. And so it's going to be a very interesting way for people to have to start to go, what do I need?
And the accessibility of that and the cost. All of that factored into one. Well, this is a big talker, that's for sure. Thanks for coming in and chatting with us, Jennifer Lake. Appreciate it.
Thanks so much.
If you like that video, make sure to subscribe to the Your Morning YouTube feed, where you can find all kinds of new content posted every weekday morning.